briefly introduce myself. I'm Chance Hao, you can call me Chance, from Shanghai, China, and VP and R&D Director of JuneYao BioGrowing Research Institute. And previously, I focused on the research for prebiotics. Now I focus on the probiotics. So both of them are focused on the microorganism in your body. First, I would like to talk about the skin health benefits of 𝗭𝗵𝗶 probiotics. This is a publication done in Pakistan, actually, 2 years ago, using our product. So you can see here, using our strain for microorganism strain. So the product is called 𝗵𝗄𝗏, and they have 3 groups, group A, B, and C. And in group C, they combined the antibiotics and the probiotics to reduce the disease. You can see the results here. The million count of all groups at each follow-up, they follow up at different time points. Actually, there are 5 time points and last 3 months. And we can, from this data, we can conclude that probiotics have equal efficacy as the antibiotics, and if they combine together, they have the synergetic effect. We can show here. These 4 strains, okay. These 4 strains combined together, and the dosage is 4 billion CFU every day, and the treatment lasts 12 weeks. And we can see here, they have 3 groups. Each group, they have 25 subjects, and the conclusion is that, for the first group, group A is good, but for the group B, it's better, but for group C, it's the best. So combined together, you can get the best result. So our conclusion is that our probiotics can be used in combination with antibiotics to get the best results. It's the 𝗵𝗄𝗏 vulgaris. It's for the adolescents on the face, okay? Something wrong, maybe? Hey, I need help, okay? Sorry, just a moment.
What is kind of the mode of action of this? How they work?
Sorry. Maybe I can answer your question in the end. Okay. Yeah. Okay. This another clinical trial. We can see here our strain rhabdomyolysis. We call it the code is LR-G14, and the dosage 5 billion CFU every day, and the treatment lasts 8 weeks. And we can see our strain can reduce the clinical score of disease severity. So it can be used as adjunctive therapy to help reduce psoriasis. Okay, next we would like to talk about mouth health benefits of 𝗏𝗏𝗏 𝗏𝗏𝗏𝗏𝗏. We also have 3 groups in the clinical trial. In the group A is our strain, and the dosage is 3 billion CFU every day, and the treatment lasts 4 weeks. We can see they have 6 visits with the 1, 2, 3, 4, 5, 6, and 3 stages. Washing period, experiment period, and washout period. During the first period, I mean washing and experiment, all the subjects received the probiotic strains. So in the experiment period, the subjects don't wash their breath and don't use the toothpaste last 2 weeks, so they get the gingivitis disease. We can see the result here. The MGI, data MGI is the primary results of clinical trial, and the second and the third one is the secondary results. So our strain 𝗏𝗏𝗏 𝗏𝗏𝗏𝗏 using such dosage 3 billion CFU every day and 4 weeks can reduce the gingivitis inflammation, can promote the recovery from experimental gingivitis, and inhibit the bacteria accumulation on the tongue and show stronger microbiome modulation potential. Next, I would like to talk about the kidney health benefits of our 𝗭𝗏𝗏𝗏 probiotics. We have two strains here. The first strain is the plantarum RPG18, using the dosage of 5 billion CFU every day, and the treatment time is 12 weeks. And the subject, is the feasibility study, so the subject number is very limited. In the probiotics group, we have 2 children, and in the control group, we also have children. And the 2 children also have very severe kidney disease. Now we can get the results here. For our strain RPG18, can decrease the serum, triglycerol, and the total cholesterol level. And also reduce the pro-inflammation TNF-alpha level and increase the anti-inflammation IL-10 level. Taken together, they can inhibit inflammation. Now, it's another strain from our company. We call it 𝗵𝗵 BLG301, and the dosage is almost 1 billion CFU every day and lasts for 7 weeks. It's also for the chronic kidney disease volunteer, but at the first stage, they would like to observe the inflammation and oxidative stress. You can see here, from the data, they proposed a model. Based on the model, we can get a conclusion that this strain can decrease the inflammation and the oxidation stress to alleviate inflammation and oxidative stress of the patients to improve their life quality. And also the same clinical trial, but in the second stage, they would like to observe their aromatic toxin and organic acid and fecal pH value. We can see the result on the left. Our strain can decrease the urea concentration in the patient's serum and decrease the aromatic toxin, the PCS and IS molecule level in the serum, so can improve their life quality. And they also do some statistical analysis. Based on their analysis, they can get the conclusion that their serum PCS and fecal pH were positively correlated with the urea concentration. And then they proposed a model. Our strain can modulate the gut microbiota and then reduce the fecal pH value and then reduce the urea concentration in the patient's serum. And the final step can reduce the serum toxin level in the patient's serum. Last but not least, I would like to talk about respiratory health benefits of our 𝗭𝗏 probiotics. This is the clinical trial design. Before a marathon race a month ago, 30 days ago, we recruited some volunteers and collected their blood and saliva for analysis, and then 24 hours just before the race, and immediately after the marathon race, and 1 hour post the race, there are 4 time points to collect their blood and the saliva for analysis, and use the 5 strains here, you can see here, and the dose is 5 billion CFU every day, and last 1 month just before the race. And then after the race, 1 week after the race, we follow up by the questionnaire. Do you have the disease? How do you feel? To reflect their severity, okay? You can see the results here. Our 𝗭𝗏 probiotics can reduce the URTI symptom incidence. You can see 29% decreased, and also can mitigate the symptom severity in the URTI. That means upper respiratory tract infection, for example, COVID-19 and the cold flu, such like that. Briefly, I would introduce our company. BioGrowing company is based in Shanghai, in China, and almost 20 years ago established in Shanghai. And our products is mainly about 𝗭𝗏 probiotics. And we belong to JuneYao Group. JuneYao Group have 4 Asia-listed entity, almost 20 billion value US dollars. Actually, China Eastern Airline, we are the second shareholder of China Eastern Airline. And the credit rating and the top 500 in China, and have employees more than 20,000. And we belong to the third one, the blue one, okay? We belong to the JuneYao BioGrowing, JuneYao member. And BioGrowing, the picture of our factory. And we have a global business around the globe, and more than 27 countries and regions. And these are ranking by a third party, Illumina Intelligence, top 3 in immunity and top 5 in digestion probiotics supplier. Stuck here, maybe. Sorry. Oh, sorry. Yeah, probiotics. Can we move on? Okay. We have a functional study, in vitro and in vivo and a clinical study on our strain. Okay, actually there's part 1, this is part 2, part 3. Okay, please visit us at hall 3 and booth number C6, okay? Thank you for your attention. Thank you.